I haven't experienced it before, but someone recently told me that this is what you do. So now I have permission to stick my tongue out when I go and see a doctor. Very excited about this.
How liberating.
Chinese medicine is no longer for grandma. It's also suitable for young generation.
I wouldn't use AI to diagnose myself personally. I don't know about you, Wendyl.
They adopted something like an ice blanket and to put on his back to cool him down. Because this high fever is very dangerous.
Yeah.
At the same time, in TCM, we believe in the back, there is your dual meridians.
Welcome to the China Popcast, where we unpack culture and social trends popping in today's China and maybe even the world.
Today, we're very lucky to be joined by two distinguished guests. We have Professor Wang, and his English name is Leo, Professor Wang Lepeng. He's an envoy of healing culture who shares the harmony of traditional Chinese medicine to the world. And to my left, we have Angela, whose name is Dr. Zheng Zhishan, a dedicated practitioner of TCM Global Communication. Welcome to both of you.
Welcome, guys.
So today we are going to talk all about TCM and the new trends of TCM. But Wendyl, my mom always tell me that if you are scared of something, you should get it over with first.
Like me and acupuncture and needles.
And me with tongue reading. So I think we might as well start today's show with a very interesting tongue reading of TCM, which is a basic practice of TCM. When you go see a doctor, we show our tongue to the doctor. So Professor Wang, would you do the honor first?
Okay.
Okay, let me
Would you
stick
like
out my
to show
tongue.
me your tongue?
Okay. Never heard that before.
All right. So let me describe a little bit. It's like red colored tongue covered with some white tongue coating. And in terms of the shape, I think the tip of the tongue, you lax the tip of the tongue. That indicate deficient heart blood. So my general judgment based on the tongue checking is, first, your constitution is more like we call that cold and damp constitution, and pay attention to your digestion system. Another is you need to have more sleep, okay, to nourish your heart. Okay, so that's my first impression. Do you really sometimes have sleeping problem or feel constipation when you work hard?
My sleep problems would be not able to wake up in the morning well and fatigue during the day. And I do get palpitations when I have multiple jobs to do at the same time. So when I'm under stress, I do feel like my heart is racing.
Okay, got it.
Oh, wow. And more on that later during the show. And it's my turn.
Okay, can you show me more? Yeah, thanks. Well, the color of the tongue is, I would say, red. And then on the side, we can see tooth mark. The tooth mark indicates a spleen is your spleen deficiency, or you may take it back. And also, I also see on the edge of your tongue, I see very small red dots, which indicates fire. So I would say there's a bit of a heart fire, which is quite normal because these days we all have a bit of anxiety, and that goes with heart fire. And spleen deficiency goes with overthinking because we all have a lot of things to do at one time. So it's also a common issue for most people.
Thank you so much, Angela, and thank you, Leo. Wow, what did you think, Wendyl?
I felt like some of it was quite accurate, and that Dr. Wang was able to tap into sleep issues and stress issues, I guess. So maybe at the beginning of a diagnosis or a session, this could be a very useful thing for the practitioner to continue with you. I haven't experienced it before, but someone recently told me that this is what you do. So now I have permission to stick my tongue out when I go and see a doctor. Very excited about this.
How liberating. And what Angela told me about the teeth marks and the efficiencies actually, the deficiencies actually reminded me of a lot of social media videos I see, especially in English on foreign social medias like TikTok or Instagram these days. There seems to be an emerge of TCM practitioners or TCM students who study TCM but can't speak English, and they somehow find this way to make little videos or reels of their knowledge, sharing them in bite size on Western social media, that they're gathering a lot of followers.
Yeah.
So I was wondering if you guys are aware of this trend that Chinese traditional medicine is being taught in English overseas in social media, and it's becoming a trend. And how do you guys think about this trend? Maybe I'll start with you, Professor Wang, first.
Okay, that's a really good question, especially like special 2025 one, because more and more doctors, including Chinese medicine doctors, have like social media. I'd like to compare it like the qi in Chinese medicine because it moves very fast, invisible but very energetic. It circulates everywhere. So it's a good way to share knowledge. But you know, like everything has two sides because on social media it's very short. So sometimes it happens they explain what, but they didn't explain the why behind the what. So sometimes it's like effective, but sometimes it's misleading. Okay, so I think for Chinese medicine doctor, if they use social media, it's better to balance like the effectiveness and also the why behind the what. Then that can help people share the wisdom. And I'd also like to tell the audience sometimes each individual is different based on their own like constitution, their own condition. All right.
Thank you, Professor. Yes.
I'll take your tongue, for example. We were talking about I can see a heart fire and also there's spleen deficiency. These are what we say usually the causes, and they can lead to different symptoms. And all these symptoms can be in very different groups, and they may overlap. For example, when we say spleen deficiency, that usually leads to people don't want to drink a lot of water during the day. Some people say, I only drink
Guilty.
500 milliliter of water per day. But at the same time, I also see anxiety, which leads to heart fire. And when the heart fire burns up to here, people sometimes feel very thirsty. So people with spleen deficiency but a really strong heart fire can still be quite thirsty. I mean, thirstier than, normally. They may be drinking like 3 liters of water a day and still feel thirsty. So it really depends this person's specific situation. So we'll have to see. So just simply say, oh, that's spleen deficiency. So you don't drink a lot of water. You need to improve and drink more water. That may be misleading.
I really like what both of you said. It makes me think that maybe social media is a nice tool, a modern tool to get people interested or get sort of familiar with TCM. But if you want to diagnose yourself based on social media, maybe that's a little lucky.
Which brings me into, we're dealing with a young audience here who are largely Gen Z, who are on TikTok and getting a lot of the TCM advice from this platform. What are your guys' thoughts about this age group of patients as TCM patients? Have there been any trends among Gen Z patients that come to you, and are they curious about TCM?
So really in practice, not only in the classroom, but also in clinic, we found more like younger people, like Generation Z. It's a good trend. Actually, some like young people get to know Chinese medicine, not in a clinic, but through like internet, like TikTok or Instagram. They sometimes come to Chinese medicine doctor, not for treatment, but for like prevention or self-care or like live better, look better, even think better. So I think it's a good trend. Chinese medicine is no longer for grandma. It's also suitable for young generation. Actually, to some extent, I think they bring the ancient wisdom to a like modern style. That's why now here's like herbal tea bar, even like herbal coffee, and there's a term called like
Goji
punk,
cocktail.
like a punk
Yes.
house cultivation, because they bring a lot of like modern and also a stylish lifestyle into like ancient Chinese medicine. That's good.
And what do you think, Angela?
Well, I actually think it's interesting because in the very old days, the younger people back then would say, "Oh, I'm pretty healthy. I don't need any, medical treatment." And now I do see a difference in the trend. Nowadays, these young people are saying like, "Oh, I want to keep healthy. So when I'm older, I can still be quite sporty. I can go out and see the world." And I do think that's actually a quite responsible attitude towards their own health. And because they have more resource to look around and see what's going on. And a lot of people do, well, my patients would say, we see a lot of videos and they feel they've been self-diagnosing themselves and think they've got every disease. and therefore they want to see a doctor and see what is really going on, which I think is quite cool. So the internet tells people that you should pay attention, and then they come to the clinic and see what is really going on. And people are quite open, especially to like I would say herbal teas, like Professor Wang mentioned. They tend to drink less traditional soup, but do it in a more modern way.
Yeah, very nice. Wendell, have you had Goji coffee in your life?
No, I have not had this. I've heard a lot about the infused teas and coffees, but I have not tried the goji.
Well, I know what to get you for your next birthday present. So we talked about modern technology or modern trends in TCM, specifically social media. And I want to throw another thing into the mix, which is AI. I wonder if you guys have ever thought about, or have you already are using AI in some of your diagnosis or your work? Maybe Angela, Professor Wang, who wants to go for, maybe Professor Wang.
Okay, as far as I know, some like organizations and including some Chinese medicine doctor trying to do research based on like AI, because AI really help people a lot. For example, they are like inventing some machine based on AI for like to assist the diagnosis. But I tried. Sometimes like medical knowledge from AI, we should be very careful. The doctors should select, because some information are misleading, but some are correct. But I think the reason is AI also need more like input from Chinese medicine, and then the experienced organizations or doctors can like judge which information is correct and then polish it. Gradually, I think it's a really powerful trend. It can help doctors, especially not like experienced doctors, young doctors. They help young doctors to have like better like diagnosis and even treatment method advice.
Thank you.
Well, AI for sure is a very interesting tool, and the whole world is trying to explore how to interact and how to use it.
Yeah.
I would say I see some institutions that are using AI to do online diagnosing for distant patients. For typical, for patients with very typical symptoms, it's working. But sometimes patients can be quite complicated, and the current AI probably will need some human instructions and experienced doctor to help with that. At the same time, AI is helping doctors to do a better patient management. For example, a patient history. And I think these kind of information would be, a technique would be quite helpful in clinics to facilitate our services.
I love what you both pointed out, that I think to my limited understanding of TCM, this really shows that TCM is not a practice that's one size fit all. if you use AI, like you said, it's you run the risk of diagnosing someone with a typical symptom. But if this person has, like you said, the heart failure versus actual deficiency of not drinking enough, then if you just use AI or if you just watch a social media video, maybe you don't see the extra layer to the patient.
And it makes us think about what next year, the year after could look like with the development of AI. Like, how much more intelligent is this good thing going to get? Is there going to be a TCM chatbot that is so smart when it comes to this? Or maybe even a tool that TCM experts can use together. You know? So let's chat a bit about combining treatments. You know, I, for one, have back issues from typing for years at a desk. And so I've tried to combine Tuina, you know, like Chinese massage, with physio as an approach to try and get advice from both systems. And a lot of the TCM influences that we were talking about, they always discuss it's not one or the other. Like, we can use both systems as a complementary approach. What have you noticed among patients and practitioners when it comes to combining treatments? And, you know, could you perhaps reflect on what's happening in hospitals in China? I've visited a few where sometimes a doctor is prescribing this and that, you know, something from TCM and something from Western medicine. So what are your thoughts on this, Angela?
Well, I actually think from my experience, because I worked in a comprehensive hospital, and there are TCM departments and also all other traditional Western medicine departments. What I see is it's actually quite effective when we combine these treatments together. And quite often, the TCM department where I work for, we do get a lot of calls from other departments.
Ah, okay.
One side is we have a lot of patients who stay in wards, and they sometimes, let's say, when they take Western medicine, there could be side effects. And TCM treatment is quite effective to reverse these effects. So we often work together. And at the same time, TCM, the approach we see this is we see people as a whole. And Western medicine is quite standard. If you show these treatment, if you show these symptoms, you will get these treatments for sure. And everyone is the same. But from my experience, I've seen, for example, a very senior patient. I was called because he has a belly pain at midnight every day, and it's so painful that he yells at night, and other patients couldn't sleep. When we asked about his situation, he had a lung inflammation. It was really bad, and he had a very high fever. So in the end, they adopted something like an iced blanket and to put on his back to cool him down. Wow. Because this high fever is very dangerous.
Yeah.
At the same time, in TCM, we believe in the back, there is your dual meridians. That's where all your yang energy is at. And when we put something ice there, it cools down the whole yang energy. And I took a second thought, because his pain is the worst at night, when the yang energy is the lowest. And that leads to the conclusion I've decided, because his yang energy is very low, he couldn't move the qi inside his belly. And at night, his belly looks like a balloon. And that's why where his pain was at. So I did the treatment to restore his yang. And he was very happy, and it worked right away. And everyone was happy because his inflammation was controlled, and also his other side effects were controlled. And so that was a perfect example. We worked together.
Could I insert a question here? If he had high fever, how do you restore his yang without overheating him?
I think that's the charm with TCM, is that everything, we don't just do one thing to heat up yang, it's actually balancing. A lot of times we're balancing the energy, not just do one thing. So I restore his yang, but we do the treatment at the same time. We're also watching, because it's very instant. I do acupuncture, it's instant. I watch his reactions.
Oh, okay.
And because we also try to balance all his internal organs, we don't just work on one separately.
So you took. So what happened was, did we take off the ice blanket from his back, and then try some things to try and bring down his temperature in a different way, or?
Yeah, the ice after when his fever with the ice blanket, it
Yeah.
cooled down his fever,
Right.
and so the fever part is good.
Right.
At the same time, he developed a horrible belly pain,
Okay.
and then I was called just for the belly pain.
Okay.
Taking our audiences in mind, I want to ask a question for our audiences because most of them live overseas. And if I was living overseas, hearing what you said about the blanket and everything, I would feel a little worried because in overseas, most of them have access to not Chinese medicine. So if they go to a doctor and they get diagnosed with fever and the doctor want to cool down their fever by putting something cold on themselves, without the availability of a Chinese doctor, what can they do?
Well, first of all, I would say in Western and Eastern medicine, there are very good doctors, and both cure.
Oh, good.
So don't worry. At the same time, probably the best thing they can do would be stay healthy and build a very strong immune system.
And then for like fever, stay at home. Just take something hot and warm and sweat. Then the fever can be gone soon. Like hot soup, or just cut some vegetables and boil and drink.
So I guess all of my friends who like drinking cold water or ice matcha, ice latte, I guess this is a good episode for them to listen to.
Drink warm drinks.
Do you guys, Professor Wang and Dr. Zheng, do you advise hot water over cold water for all the times or just for winter colder months?
Actually, first, based on seasons, and second, based on your personal institution. For example, my constitution is more like cold and damp, so I prefer like warm water or hot tea. But for some like people, the innate constitution is more like warm, so cold water is all right, but not too much because coldness really like damage the yang qi.
What do you think, Dr. Zheng?
I would say it depends. In really hot summertime, room temperature water would be okay.
Okay.
But I wouldn't recommend anything from like a really cold refrigerator. At the same time, if you really want to drink something cold, you may as well add a little bit of ginger in there
Okay.
to warm up. So it's both natures in there.
Because ginger is warm-natured.
Ah, very nice. Very good tip.
A cool ginger drink. I could do that in summer.
Yeah,
And it's tasty.
Yeah.
it actually sounds very nice. I'm already looking forward to the next summer. So I want to reintroduce my co-host Wendyl. Wendyl is someone who's lived in China not for a very long time, but he is very passionate about Chinese medicine.
Yes.
And
getting deeper into it.
yes, and he's very excited about this episode, and he basically didn't sleep before this episode.
That's why I didn't sleep last night. I was so excited. I was practicing pulling my tongue out.
And that's why he was so he was showing the I was just joking, but I want to say first of all, before I introduce the next segment, Wendyl, do you want to sort of give us a quick spontaneous recount about your story with TCM, I guess?
So I got to China maybe about 3 years ago, and I started making friends who are from this country and are very familiar with it. And sometimes people would start saying things like, you should do this at this time of the year. You should try Aiju, which is moxibustion in English. And then also some of the work that I do in the culture department exposed me to a lot of TCM. So one summer I started reading about Sanfutian, and these are the kind of things that you do at this part of the year, and started getting me a bit curious. So over the years, I've tried moxibustion, I've tried bagwan or cupping, which I do when I feel like my back is not where it should be and my blood flow is not good. But one thing I've avoided all of these years because of the idea of needles is Jinju or acupuncture. And so, work is a good place to do everything for the first time here in China. So I'm about to undergo some Jinju with our doctors on the show today.
Yes.
I just got some idea because, like Lucy mentioned, you didn't sleep well, and when I check your tongue, I think you should be pay attention to your heart and lung as well.
Okay.
So my idea is we will insert a needle into your like 内关 acupoint and the 神门 acupoint, which helps the like heart and also calms the mind. All right. So would you help me to clean it first? 我来吧。
So this is, I guess,
alcohol, 75%
alcohol.
alcohol. Okay. So this is a 内关 acupoint.
Okay,
It's
on my wrist?
Yeah.
Okay.
So it's like almost 3 fingers below the wrist, and also like between the 2 tendons here. And another is like 神门 acupoint. Sounds like the gate of the spirit to help you calm down. Okay. And then
So
we use.
Angela, is this to sanitize the acupuncture point first?
Yes.
Can I ask if this is going to be painful?
It's
Well, you soon will know.
you will feel that.
Actually,
Okay.
Can you feel that?
Yes, I can.
So that's called arrival of qi. Okay. Usually when we insert the needle, we do a little manipulation,
There's
like
a needle in my wrist.
yeah, like lifting, thrusting, and twisting until you feel the arrival of qi. That's good. It means the qi in your body starts to work.
Starting to hurt more. Is that accurate?
Oh, does
Okay.
it hurt?
And
Yeah, a
then
little.
Shenmen acupoint. Okay.
Oh,
so
good.
you come down. What
What
did
do
you
you
feel?
feel?
Okay.
I felt a little jolt on this side, and then now this
Mm-hmm.
finger is starting to feel a little.
Yeah, that's a kind of radiation. That's good
Oh.
phenomena.
Mm-hmm,
We call that 得气, arrival of qi. So that means because that's Chinese acupuncture is based on meridian or channel or collaterals. This is heart meridian, and one is 心包经. Anyway, it's both channels are related to the heart, so they can solve the problem of palpitation and also calm your mind. You will sleep better tonight. All right. Okay,
Oh.
relax,
Okay,
relax.
relax.
Okay.
Awesome.
So the chi is starting to flow. Do you feel that?
I can feel a difference in the flow in my arm,
Mm-hmm.
but yeah, it does feel like there's like this finger's sensing something.
That's the heart channel. Okay.
Oh. And I want to ask, in Chinese medicine or acupuncture, is there anything as you have to, because when you do yoga, after you practice one side, you have to do the other side. So for Wendell, after this arm, does he have to do the other arm to balance it out?
We can do both.
You don't have to.
Yeah, because the right arm is close to me. Usually, for heart problem, we do the left arm because it's closer to the heart, and we can do both. But I will leave one hand for you to do something else.
Oh, okay.
And how long do the needles have to stay
Yes.
in?
Usually, for like acute problem, about 15 to 25 minutes. And for more like chronic problem, usually longer time. For example, insomnia or some like chronic problem, like about 1 hour.
Oh,
Do I have to keep my hand very still during this, or can I?
Very still.
Okay, so I have to keep it very still. Okay.
And can you do that while hosting the show?
I think I can.
Okay. Actually, there are many schools of acupuncture. For example, this kind of like inserting needle is along channels. And for example, Angela is good at doing like belly acupuncture. Every person's belly reflect the function of the whole body. And I do like navel acupuncture, just around the navel. Some people do ear acupuncture, some do scalp acupuncture,
yes.
and there are many, many schools.
Oh,
This is very convenient to show. Okay.
Yes, yes. So Angela, you are good with the bellies?
Belly, it's called abdominal acupuncture.
Oh, wow.
It's only here. So all the issues, I work on the bellies and actually only on the fat layer. So it's less painful.
And this can help with the whole body or just the abdominal part?
It's the overall body because we believe there is a mini person lies, a mini you lies on your belly.
Like microcosm reflect the macrocosm.
Wow. I believe that, but I've also heard that your feet also
same.
has a mini you. So how many mini yous do we have?
Each part represents the whole. So
Like
there's
palm reading.
yeah, that's your whole body in your
Palm
hand.
reading.
Oh, wow.
And also pulse checking, and even like ear acupuncture. And as I mentioned, I do like navel acupuncture. Just I can judge the problems just by looking at the navel.
Oh,
He also does naval diagnosis.
Oh, wow. I really love that each part of you is a small cosmos of your whole body.
Exactly.
Wow.
And it has effects on other parts of your body that you don't always think
Sure,
about.
sure.
Yeah, yeah.
Because all the systems are connected by channels and the collaterals or qi and the blood flow inside.
Yes. So this is a great segue for my next question, talking about everything being interconnected. For years that I've lived now in the northern part of China, I've observed that the lunar calendar is really well calculated to the change of season. And I have read that TCM or traditional Chinese medicine is also sort of strictly based on this lunar calendar system. Am I right? Or why is it based on that? Which of you?
It's all from the observation of on the nature in ancient times. Not only the sun, but also the moon, and also their interrelationship. Actually, we are not influenced, not only influenced by sun and the moon, but by some other like planets, like the Jupiter, Mars, and so on. My personal research is based on the like harmony between human and nature or the universe. So we consider all these issues, not only moon, but also sun and five other planets, and then put all the information together, then consider like 3 Ws, like who, at what time, and what kind of disease may occur. Who means your like birth date, your personal constitution, and your innate weak organ. At what time? For example, this year, more people suffer from lung problem because this year is a year of like metal deficiency. And then we can decide or predict what kind of problem may occur. So that's a good example of like human and nature are corresponding to each other. And that's also like representative of Chinese medicine wisdom. We should follow the rhythm of nature.
And thank you for correcting me. I shouldn't say that the ancient Chinese calendar is a lunar calendar. I think it was a solemn
Combination.
combination of different observations.
Sure.
But I guess I have a different question for Angela, which is like Professor Wang pointed out that it was based on the ancient observation, but now we have a lot of changes around the world and the seasons change. For example, this year, Beijing got cold so quickly. So can we still strictly follow this, or how does TCM adapt to modern changes?
Well, our little universe echoes with the bigger universe. So it really depends on the specific situation where you're at and the overall climate. If the climate changes, even if we have the same illness, the treatment also changes. And that's with the Asian TCM. One policy could reflect the whole thing because we say you have to do diagnosis. I think our little universe echoes with the bigger universe. You have, like Professor Wang was saying, it's who is this person? Who is sick? Is it a man or is it male or female? At what age? With what kind of, is it a strong person or a weaker person? It all differs. And when the climate changes, it also changes. I have a friend in Malaysia, and she invites a lot of famous Chinese doctors to go overseas and teach. And there's one time she had a bit confusion, and we discussed. And she said she invited someone who's very famous in northeast of China, where it's very cold. And that doctor has practiced their lifelong. I mean, it's a senior doctor and well established. But when he was in Malaysia, the same prescription didn't work very well.
Sure.
And it's because in Northeast, it's a very cold place.
And then 4 seasons, but in Malaysia, only 2 seasons, summer and a rainy summer.
Even when people get the same, like they got a cold, the prescription will change. And if they stick with the same prescription, it didn't work very well in Malaysia, where the climate is different. So when the weathers change, our prescriptions, our treatment also change with the weather.
And that is also why you cannot use AI.
Sure. And we are not following, for example, Chinese calendar, but following the natural calendar. For example, now it's cold in Beijing, but hot in Sydney, right? So the principle for health cultivation is changing because climate is different.
Great.
Which brings me to a segue question, like how has TCM been adapted for the Southern Hemisphere? Because I mean, some of our audience are watching right now are living through summer as we speak, and we're talking about winter remedies. And I wonder about how, you know, a TCM expert living in Sydney or Johannesburg or Brazil is going to adapt some of this ancient wisdom for a part of the world that's experiencing seasons at the opposite time of the year. So maybe are they doing Sanfutian and what we would do in July in January? Or, you know, how has this been adapted for this global South? Yeah.
I've always had a question, do the Southern Hemisphere have a Sanfutian?
Right. Is the calendar like flipped around for patients in other parts of the world?
Just follow the natural calendar. It's opposite. Not follow the fixed solar calendar. Follow the natural rhythm. That's our idea. We should balance the wellness with the rhythm of nature, no matter where you are.
I think it's a bit similar. It reminds me of, I think you're also doing some research on the Western signs and zodiac and stuff like that.
Sure.
When you're trying to do a more specific calculation, they ask when you were born, also where. And this location is important.
Yeah.
I was wondering if you two could unpack natural calendar a little bit more, because I'm listening, but I'm getting a little confused. How do I, what is natural calendar and how do I actually follow it for the whole world? How do I see it? Because I can only see 12 months on the calendar.
So as you mentioned, for example, this year, Beijing came to winter quickly, right? So although based on the calendar, it's still autumn, but people feel coldness. So we can adapt to the rhythm of nature.
Oh, I really like that.
And say use your own body. For example, in Beijing, this year we're having a shorter autumn.
Yeah.
We just go into winter streak. If you look at the calendar, it's, oh, it's not the time yet. But in fact, if you go out, it's cold. You feel it. You know, just talk to your body, and your body will tell you how it feels and then react to it.
So as the doctors, you have to adapt with your diagnosis and your treatments every year as the things around you are changing. Because I know sometimes as residents, we think, okay, this solar term starts now. This is the first frost. This is when we start putting on our clothes. But maybe it's up to you to decide to tell people, no, follow the natural order of things around you rather.
Yes. So if the weather forecast says it's going to rain, then react to it.
Take the umbrella.
Yeah.
Yeah, I got it.
Okay. Chinese medicine is quite flexible. It's like a dynamic balance of yin and yang.
Which is why it is difficult for AI.
Yes.
It's not black and white.
Yes, it's not black and white, and it's difficult for AI to give a specific diagnosis. And Wendell, how are you going over there?
You know, I got so used to talking, asking with needles in me that I think after my first go at acupuncture, I'm definitely more curious about what needles in other parts of the body will do for other parts of my body.
Amazing, well done.
Thank you.
So we were just saying that it is difficult for AI to make a conclusion based just without seeing the patient. And also, I guess it is getting back to our first question, it is also a little difficult for a social media video to give you the whole information. And because we're having such a good discussion about modern trends and TCM today, I want to just throw in another spontaneous question, because what you were just mentioning about listening to your body, it reminded me of a sentence, using your body as the compass. And this also reminded me of another point, which is in psychology or in mental health. A lot of the times, people are saying that you shouldn't just live in your head. You should not thinking so much and bite your tongue. But actually, you should listen to your body, go back to our bodies, which is what people say that in the modern society, people don't do often, to go back to our body. We live so much in our head. And I was wondering, just maybe briefly, do you see any link between TCM and mental health? Are people trying to use TCM to help bettering mental health these days? Maybe start with Angela.
Yes, because we believe that our 5 internal organs, they're linked with certain feelings and emotions. For example, I have a patient who complained about high blood pressure. And in fact, it turned out to be he just had a fight with his wife about how to raise his grandson. Shall we give him more treats? So he was very unhappy, and this liver fire goes all the way up and gave him a very high blood pressure. So what we do is we try to take down the liver fire. And people who often have a fire issue, it does affect their liver physically. At the same time, it also brings up their blood pressure. So we do internal organ balancing. At the same time, we also regulate their mood. So after the treatment, he'd feel more peaceful and more balanced and happier.
So actually, traditional Chinese medicine is like body-mind medicine. Each organ is corresponding to like emotion. For example, Angela mentioned like a liver is related to anger. Like too much, like over anger damages liver function and cause high blood pressure. And overjoy damages the heart. And like overthinking damages the spleen. That's what we mentioned on you. Okay. And also like fear or fright damages the kidney. And also like too much sorrow influence the lung. And do you know in the like Rand mentioned 红楼梦 林黛玉 she was always, you know, like feel like
crying, unhappy.
crying,
Dream
and
of the
then
Red Chamber, the female protagonist.
and then she died of like lung problem. Okay, so Chinese medicine generally consider not only physical problem but also mental problem. That's like integrated system.
Wow, a TCM for modern day humans. What do you think, Wendell? You just had your needles taken now. Any feedback or any?
I think after a few minutes, I wasn't really noticing much pain as like when the needles first went in. And now that they're out, I feel that area is a bit relaxed. Yeah. I think it's been quite an interesting to hear how my favorite bit was hearing about how adaptable it is, because I've often encountering it just from theory, listening to people, that it's a very stiff thing that you do certain things at certain times of the year. And from listening to the two of you today, it's really nice to hear that I can take elements of this and adapt it for living in Cape Town or in South Africa. But it's about listening to the seasons and listening to my body. So yeah, and I think also interesting to see the future of TCM with young people, AI, and the internet. I'm curious about what next year we'll be talking about when it comes to TCM in the future. Yeah. So that was the China Popcast, where we unpack culture and social trends popping in today's China and maybe even the world.
And before we close our episodes, we always have an opportunity for guests to talk about their future projects. So I guess I'll start again with Professor Wang. Do you have any future projects that you're working on at the moment?
Okay, so also based on my experience, health has no boundaries. So I think TCM, like also that's our plan to realize people's health awareness based on TCM some principles and also help more people to cultivate health all over the world.
Thank you. The harmony of Chinese healing.
Yeah.
And Dr. Zheng, what are you working on at the moment?
Well, aside from being a TCM practitioner, at the same time, Professor Wang and I were working together to promote TCM at global communication, and hopefully we'll share the wisdom with the whole world.
Amazing. This is what we're looking forward to. So we are very happy to have you, and we are looking forward, of course, to have you again on our show. So guys, this is this episode of the China Podcast. Thank you so much for listening. Remember to like, share, subscribe, and comment on our episodes. We rely heavily on your support. Thank you, and let us know if there are any pop China trends that you want us to discuss in future episodes. Bye for now.